Hi, everybody. This is Julia Kahudiak. I'm a licensed nurse and a legal nurse consultant for over 4 decades. I am talking about Randy's Living Assisted Manner, and we are continuing our blogs, and this is number 9 about Hippà and the doctor. Hippà is the acronym name for the Portability Act that came into place in 1996 that provides data privacy and security and provisions for safeguarding medical information. This is an actual law, and there are lots of fines involved to healthcare providers if they do not follow with this particular law. It basically helps protect personal information. It was really designed to protect the benefits and protect the patients. In an emergency situation, obviously, these rules could make a difference concerning information and treatment. So there are lots of things to be said about this particular law. I usually have had a lot of verbal permissions over the years on the phone from various clients when I used to work at a insurance company, because obviously we didn't have the faxes going, but if we had a verbal agreement to pass on information, that was okay too. But you have to really speak to your loved one's doctor and make sure that your loved one has actually signed the information, and so they could parlay any information to you. There are a lot of legal ramifications if things are not done well. So please make sure about talking about this to your medical providers of your family member. Now, also, when you speak to the insurance personnel, and this is where I came across some issues, you need to make sure that they're able to verify who they are and with a date of birth or something to say who they are, and then they're giving permission to basically speak with you. And then you want to know who you are in terms of a relationship to your loved one. And, of course, the policy number, the name and address where the bills are normally sent, any bill information, the diagnosis on the bill. So if you have any questions, normally there's an explanation of benefits on these bills, should this be one of the questions you're having. Also, I found it very important that if you're having a conversation with your with the people at the insurance company, one thing you want to make sure is that you have the name of the person you're speaking to, their telephone extension number, and their credentials. Also, ask them to repeat information if you do not understand something that was said to you. One thing for sure is always be prepared when you call the insurance company. Take very good notes. Like I said, it is important to make sure who you were speaking to, the date of the call, and the information you were given. Be very clear and concise. And also, if you get irritable, it doesn't help the situation. So I'm just telling you in advance. I know sometimes people get hot under the collar when speaking to whether the insurance company or perhaps a healthcare provider because of a situation. But again, that doesn't make things any better. So I think it's good to be able to have a calm manner when speaking to somebody. So I'm hoping that this information was helpful and useful to you. And if you have any questions, please give us a call at 315-200-0658.